The pandemic has exacerbated a mental health crisis with employees working from home and suffering from loneliness, isolation, and burnout. Employers and venture capital firms are waking up to the fact that people need support more now than ever. With surging demand and venture attention, the mental health startup Modern Health has raised $51 million in its latest funding round, led by Battery Ventures, O1 Advisors, and more. The platform offers a suite of mental health solutions, including digital programs, virtual coaching, and clinical therapy. Joining us now for more, the founder and CEO of Modern Health, Alyson Watson. Alyson, thank you so much for joining us. So give us a picture of demand amidst the pandemic as we head into the holidays, when there are a lot of people who are alone out there, who are separated from loved ones. And even though we have a vaccine now, for many of us, it's a long ways away.
Thanks, Emily, so much for having me. I'm a huge fan of yours, so super excited to be here. And yeah, to share a little bit more about Modern Health. So we are a mental health benefits platform for employers. So we work with employers to make it easy for their employees to get access to the resources they need. And as you can imagine, have seen massive increase in the need in 2020. But really, we were seeing an increase in the need coming into this year. I mean, coming into 2020, mental health was the #1 cause of disability worldwide. So the #1 reason that people took off from work, even before this pandemic hit, was related to mental health. Now, this has just been a massive accelerant for the entire industry, and we're seeing that this isn't going away anytime soon. In fact, many are calling for the fourth wave of this pandemic to really be a mental health pandemic, and it's only going to increase the need from here.
So what are you hearing from employers in terms of what they need and how they want to support their workers? It's not, necessarily something that employers have obviously felt responsible before for, but in this unprecedented situation, we're seeing companies wanting to take a greater role in the emotional well-being of their workers.
It's a good question. So we think about mental health as the fourth pillar of benefits. So you've got medical, dental, vision, and now mental health has become that fourth pillar. And the reason behind that is because you can't get access through traditional medical benefits. If you try to access or find a therapist through your traditional health insurance, it's really difficult. And there's a number of reasons for that. Number one, most therapists don't accept health insurance these days. And they don't accept health insurance because the national average reimbursement rates are so low. Number two, there's a shortage of therapists. So with the ever increasing demand and a shortage of supply, it's increasing cost and making it even harder for people to get access. And employees are really struggling. I mean, at the end of the day, human capital is the #1 asset for every employer. So employers are now waking up to the fact that you can only be successful as an employer if you take care of your employees' mental health. And so it really has become a top priority. I mean, every single employer all around the world is prioritizing mental health. It's in every board meeting, it's in every discussion, and they're looking to invest in solutions like Modern Health to be able to support their employees.
Now, as we round the corner and get closer to more vaccinations, closer to eliminating the risk of COVID, are employers going to care about mental health long term? Are they going to care about offering this kind of benefit a year from now when, the risks aren't as high, many people are back at the office, and there are other priorities?
I'm so glad you asked that, because I think if there's one thing that we've learned from this year, it's that mental health needs to maintain a top priority for employers. We shouldn't have to wait until we're in crisis mode as a society to take care of employees' mental health. And in fact, mental health has always been a top priority. But I think if there's a silver lining to this year, it's shown that mental health is just like physical health. It falls on a spectrum. All of us fall on that spectrum from green to red. That's how we think about it at Modern Health. And it ebbs and flows at different points in our lives. I'm sure a lot of us are feeling a little bit closer to the red zone right now. But the reality is the way that the population breaks down is a typical bell curve. So you have about 15 to 20% of the population in the green, 50 to 60% of us in the yellow, 15 to 20% in the red. But we all have mental health, so we all can engage in it. And in order to build a really resilient and productive population, you need to invest in your employees' mental health. And so the reason that we built Modern Health was to make a solution that makes it easy for every single person to engage in their mental health, to not wait until they're in crisis mode, so we can meet everyone where they're at. And the way that we do that is through a very easy to use app. It's a best-in-class user experience where you download an app, you take a quick assessment, you tell us what you want to work on, and in a matter of seconds, you can get connected to a mental health coach who might help you with being home right now as a parent without childcare, or financial stress, or loss of a loved one. It might connect you to a therapist who can help you if you're struggling with anxiety or depression. Or it might direct you to a digital program like mindfulness and meditation so that you can, work on becoming more mindful during these times when we're all stuck at home.
Absolutely, and I know it's going to be touch and go for the next few weeks, especially as we go through the holidays. Modern Health founder and CEO Alyson Watson, thank you so much for sharing the company with us and reminding us about some of these urgent issues out there.